dry needling is a technique that is used again with the same acupuncture needles, and is in dry needling the focus is directly on the muscle, because we choose the muscle which has the problem, which has the spasm, which has shortened as length, and the patient emphasizes this muscle as the problematic point. Like he says, I have a pain in one point since many years, and that point is itching, that point is making problem, and all the pain is radiating from that point to all my body. So in the examination we choose that point, and with the acupuncture needles we put the needle and take out to that muscle, to the trigger point of the muscle, to the main center of the pain of that muscle, and after some sessions that pain disappears because we make the muscle relax. And how does it work? It works by increasing the vasodilatation and increasing the blood flow, and it affects by sending stimulus to the brain and the spinal cord from that level, so that some hormones and enzymes are produced, like endorphin, enkephalin and other things. So in the end the muscle is cured totally. I mean, a patient comes telling that he or she used for weeks and for months a lot of anti-inflammatory drugs, a lot of analgesics, a lot of myorelaxants, but couldn't solve the problem. While with dry needling, you make it like 4 session, 5 session, or also 2-3 session, and you solve completely. And it makes an effect that is long term, that doesn't pass immediately. So if a patient has this problem, we advise strongly that he should come to make the dry needling.